So we talked about Matt and his key lesion. Anytime you have a problem with the upper cervical complex, OA, AA, occipital-atlantal joint, atlas axis joints, cranio-cervical junction, you've got to deal with that first. The goal of myoskeletal alignment is to level the sacral base and to get good alignment up here, right?
Right. It's a brother-sister relationship. Always remember that. If you don't get anything else done in your session, try to level the head and the tail. You get a lot of good results with that.
So when we looked at Matt, we found that he has, tuck your chin, Matt. As we do this, we're gliding the occiput on the atlas. And so what we want to see is we want to see those condyles glide nice and smoothly and them to have a bunch of double chins.
Right.
So that's what we're seeing here. He's really nice OA. But what he has a problem with, both sides of OA are good, but what he has a problem with is atlas axis. So when I raise him up, flex him to 45 degrees at least, it ligaminously locks through the nuchal ligament the typical cervical vertebra.
Right, and that's real important because I see this technique done wrong all the time. It's a very, very specific technique. You have to make sure those typical vertebrae are locked out at 45. If they're hypermobile, you may have to take them a little bit higher. So in this technique, notice his grip. Eric, go ahead and show him your grip.
Sometimes I use my third hand if it's a heavy head or if I want to make sure that I'm stabilizing them enough. They've got to keep the chin tucked. They can't have any trick movements when they move side to side. So we've got to make sure that we don't let the head drop. It has to have a pole, act as if there's a pole going straight through the cranium and down into the cervical spine, and you rotate around that axis.
Right.
Okay? So here's what we found. We found that when Matt rotated left,
he's got nice 45
nice.
Left.
Sometimes we want them to help with this by turning their eyes, because some people, they don't want to give control up of their head or neck to you. So one of the ways that you can help this is ask them to actually turn their eyes, which fires the optic, that has optic nerve help fire the suboccipital. So turn your eyes to the left, Matt. As he turns his eyes to the left, we see that that glide is very, very nice. 45 degrees in each direction is all we want. Okay, so I'm keeping it tucked. Now open your eyes and turn your eyes to the right as far as you can. We go, and that's it. He had a hard barrier, bone-on-bone barrier, an atlas axis barrier. Bumped into the barrier, I felt sternocleidomastoid on the left pop into this finger right here. So that, or more commonly what you're going to see is the chin. They'll want to come out of flexion. They'll want to let that chin come out.
I see that quite a bit.
And so here we go. We're going to take him to the barrier, which is there. I'm going to back off a little bit to the inner barrier zone, work from there, keep his chin tucked, ask him to turn his eyes as far to the right as possible. I'm going to follow him. That's all it was. I don't want to bulldoze past the barrier. Now I want you to turn your eyes to the left and your head to the left as far as possible. Gently, 2, good, 3, 4, 5, and eyes to the right.
Notice how Eric's got his elbows out right here too. You get those elbows out, it keeps them in that axis that we're talking about, like that pole's going through his head. It's real easy when you get your elbows out to rotate the whole head in the same plane.
Right, using your body weight. Using your own body, just rotating your own body. Okay, so I'm going to back him off the inner barrier zone. Turn your eyes to the left and gently turn your head to the left. 2, your athletes don't want to turn too hard. If they turn too hard, just use the eye movements. 3, 4, 5, eyes to the right. Keeping the chin tucked. Look at that.
Very good. Look at that. Nice.
So now we see nice fluid motion. Back and forth, clear up that lesion. Now we're not doing, this is not joint work. This is suboccipital. What's that muscle that's preventing this, Paul?
Inferior oblique.
Inferior oblique. The inferior obliquus muscle is a commonly overlooked and less appreciated muscle in the suboccipital group.
Right.
Ties atlas to axis, spinous process of axis to transverse process atlas. Okay, so when we get through, we're just going to decompress. Decompress, make them feel good after each one of these little